Good afternoon to all. Today we are under the monthly series of our sixth nutrition and education program. We are conducting our nutrition education program under the guidance by Dr. Archna Gupta and the Dietitian and Doctor team. We give the insight and more curious knowledge about the nutrition and health topic in every different topic in every month. So as we know, this month, as world is talking about the cancer. In Cancer Day is the February 4th is the World Cancer Day. In this year, the theme is for 2025 to 2027 is United by Unique, which means every experience with cancer is unique, and it will take all of us united to create world where we look beyond the disease and see the person before the patient. That means we are more conscious about the patient, not the disease. And here we are discussing and give a little bit knowledge about the cancer. So cancer is a disease in which some of the body cells grow uncontrollably and spread to other part of the body. And normally our body cells are almost anywhere in human body and made with the body made with trillions of cells. Normally, human cells grow and multiply through the process is called cell division to form new cells as the body needs them. When cells grow old and become damaged, they die and new cells take their place. Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply. When those these cells may form tumors, which are lumps of tissue. Tumors can be cancerous or not, which means cancer is uncontrolled growth of cells. Cancerous tumors spread into or invade nearby tissues and can travel to distant places in the body to form new tumors. The process is called metastasis. Cancerous tumors may also be called malignant tumors. Many cancers from solid tumors, but cancer of the blood, such as leukemia, generally do not. Benign tumors do not spread into or invade nearby tissues. When removed, benign tumors usually don't grow back, whereas cancerous tumors sometimes do. Benign tumors can sometimes be quite large, however, some can cause serious symptoms or likely life-threatening, such as benign tumors in the brain. That means cancer is the uncontrollable of growth of cells, and it can be divided into two, benign and malignant. Malignant tumors are cancerous, and benign is normally not cancerous.
तो ऐसा कहा जा सकता है कि कुछ सेल्स जो होते हैं हमारे डेवलप होते रहते हैं, टूटते रहते हैं, मरते रहते हैं और फिर नए सेल्स बनते रहते हैं. लेकिन कुछ सेल्स ऐसे होते हैं जो कैंसरस बन सकते हैं, जो बार बार बनते रहते हैं और हमारे ट्यूबर फॉर्म में बनते हैं, जिसमें से कुछ तो कैंसरस होते हैं और कुछ मैलिग्नेंट होते हैं और कुछ बिनाइन होते हैं, ट्यूमर भी, है ना. तो जो बिनाइन होते हैं वो हमारी बॉडी को कुछ नुकसान नहीं पहुंचाते हैं, लेकिन जो मैलिग्नेंट होते हैं वो कैंसर फॉर्म में कन्वर्ट हो जाते हैं. अब कितने तरह के कैंसर होते हैं हम इसके बारे में जानते हैं. कुछ सॉलिड होते हैं, कुछ ब्लड कैंसर के होते हैं और कुछ मिक्स्ड होते हैं. या
Okay, there are different type of cancers. There are over 100 type of cancers. It categorized according to where they start in the body and the type of tissue they affect. There are three broad cancer classification. First one is solid cancer and blood cancer and mixed cancer. Solid cancer means most of the type of cancer make up about 80 to 90% of all cases. For example, this include carcinoma that form in the epithelial tissue like skin, breast, colon, and lung, and sarcoma that form in the bone and connective tissue. Blood cancers. These are cancers that start in blood cells or lymphatic system. Examples include leukemia, lymphoma, and multiple myeloma. And next classification is mixed. Cancers that involve two classification or subtype. Examples, carcinosarcoma and adenosquamous carcinoma. These are the type, and we can also group the cancers in according to main five group like carcinoma, sarcoma, leukemia, lymphoma, and myeloma, and brain and spinal cord cancers. Carcinoma is the benign in the skin or tissue that line in the cover internal organs. There are different subtypes, including adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, and transitional cell carcinoma. Sarcoma, this cancer begins, which means where the place begins, its name according to place begins the cancer. And leukemia, we are already discussed, it's a blood cell cancer. And lymphoma and myeloma, it affect the immune system of body. And brain and spinal cord cancer, it also central nervous system affect the body. These are the categories or types of carcinomas. Okay, next we move on to sign and symptoms. Sign and symptoms, it will vary depend on the body part which affected. So some general signs and symptoms are here mentioned. First one is fatigue, and second something lumps or area of thickening, some under the skin, or feeling of weight changes including weight loss or weight gain, and skin color changes like yellowish or darkening or redness of the skin, or sore that won't heal, and change in existing molds like spreading, and change in bowel or bladder habits, like sometimes loose motion or painful motion, like, and persistent coughing or troubling breathe, and also difficulty in swallowing, and persistent indigestion or discomfort after eating, like stomach pain or cramping pain, and unexplained muscle or joint pain, like persisting fever at night sweaters, and also unexplained bleeding or bruising. These are the common symptoms which seen in every patient. Next is the causes. What are the causes which can cancer arising from transformation to normal cell into tumorous cell in multi-stage process that generally process from a precancerous lesion to malignant tumors. This change result in the interaction between a person's genetic factor and three categories of external agents, including physical carcinogens such as ultraviolet and ionizing radiation, and chemical carcinogens such as asbestos, components of tobacco, smoke, alcohol, aflatoxin, and arsenic, etc. And biological carcinogens such as infection from certain virus, bacteria, or parasites. These are the main causes of cancer. And next these are the pictures shows the what are the causes and root cause of and cofactor for cancer. Weakened immunity and some non-communicable disease also, like type 2 diabetes, obesity. These are the risk factor also for cancers, and nutritional deficiency also, and some environmental factors also causes cancer. Next, we discuss about risk factors. Next slide, ma'am. Next slide, ma'am.
कैंसर के बारे में अगर हम बात करें तो बहुत सारी कारण हो सकते हैं कि अगर हम स्ट्रेस में रह रहे हैं, जीन्स की प्रॉब्लम है, या न्यूट्रिशनल डेफिशिएंसी है, हमें किसी न्यूट्रिशन की कमी है ना, या डाइट हम कम खा रहे हैं, या फिर इम्यूनिटी कम है, या लाइफ स्टाइल हमारी बहुत स्लो है, डायबिटीज है, मोटापा है, ऑक्सीडेटिव स्ट्रेस है ना, इन्फ्लेमेशन बार बार होता रहता है, या फिर दवाइयाँ बहुत ज्यादा ले रहे हैं, या कुछ एसिडिटी रहती है, टॉक्सिन्स ज्यादा रहते हैं, एनवायरनमेंट में बहुत टॉक्सिसिटी है, या स्मोकिंग कर रहे हैं, अल्कोहल ले रहे हैं, ये सारे कारण हैं। और या फिर डेफिशिएंसी जो न्यूट्रिशन की किसी भी तरह की है, मिनरल की, विटामिन की, मैक्रोन्यूट्रिएंट की, या फिर हमारी बॉडी में एंजाइम्स की कोई कमी है, प्रोबायोटिक्स की कमी है, तो उन सब वजह से भी कैंसर हो सकता है। तो बहुत सारी रीजंस हैं, रूट कॉज है जिनकी वजह से कैंसर हो सकता है। तो इन सब चीजों पर ध्यान देना बेहद जरूरी है, राइट। या तो रिस्क फैक्टर्स क्या है, अब इसके बारे में जानते हैं।
which is already we mentioned the tobacco use and alcohol consumption, unhealthy diet, and physical inactivity, and family history, and inheritance, like and genetics may play an important role in the like some childhood cancers also, and exposure to some virus and environmental like air pollution, and these are the risk factor for cancer. And between 30 and 50 percentage of cancer can currently be prevented by avoiding risk factor and implementing existing evidence-based prevention strategies. And cancer burden can also be reduced through early detection of cancer and appropriate treatment and care of patients who develop cancer. Many cancers have a high chance of cure if diagnosed early and treated appropriately. So, these risk factors we can implement new interventions. Next, we move on to prevalence. Prevalence. Cancer is the leading cause of death in worldwide, accounting there were an estimated 20 million new cancer cases and nearly 9.7 million deaths were reported globally in 2022. This was the latest report published by WHO. About 1 in 5 develop cancer in their lifetime, and approximately 1 in 9 men and 1 in 12 women die from cancer disease. Three major cancer type in 2022, which are lung, breast, and colorectal cancers. Lung cancer was the most commonly occurring cancer worldwide, with 2.5 million new cases, accounting for 12.4% of total new cases. Female breast cancer ranked second largest, 2.3 million cases, and followed by colorectal cancers, 1.9 million cases, and prostate cancer, and also stomach cancer. And for women, the most commonly diagnosed cancer and leading cause of cancer death was breast cancer, whereas it was lung cancer for men. Breast cancer was the most common cancer in women in the vast majority of countries. Cancer causing infections such as human papilloma virus and hepatitis are responsible for approximately 30% of cancer cases in low and lower middle income countries. And projection predict an 87.5 percentage increase in new cancer case by 2050. Many cancers can be cured if detected early and treated effectively. These are the prevalence, which shows the what is the current level of cancer in world. And this is the cause of death or concern about the cancer. And here shows the how much of the person affected by cancer.
जैसा कि हम यहाँ पर देख पा रहे हैं कि मेन एंड विमेन दोनों के ही लोग इक्वली इफेक्टेड हो रहे हैं लगभग, राइट। मोर्टेलिटी रेट भी लगभग बराबर ही है दोनों लोगों का। तो दोनों ही लोगों को बहुत ज्यादा ध्यान देने की जरूरत है। जैसा कि आजकल हम देख पाते हैं कि लड़के और लड़कियां लड़कियां भी बहुत ज्यादा स्मोकिंग करने लगी हैं, अल्कोहल कंजप्शन बढ़ गया है, और बाकी के अदर फैक्टर्स भी होते ही हैं गर्ल्स के साथ में, जैसे कि ब्रेस्ट कैंसर उनका एक एडेड फैक्टर है, राइट। तो हमें सभी लोगों को ध्यान रखने की जरूरत है कि जो अभी हमने थोड़ी देर पहले फैक्टर्स की बात करी थी कि क्या कारण है कैंसर होने के, हमें उन पर भी बात करनी चाहिए, उन पर हमें ध्यान देना चाहिए, और फिर उन कारणों को ध्यान में रखते हुए हमें प्रिवेंशन पर काम करना चाहिए। क्योंकि ये बहुत बड़ा कंसर्न है कि आज की डेट में इतने अधिक आप देख पा रहे हैं कि लगभग 14,13,316 नए कैंसर के केसेस देखे जा रहे हैं, मैन और वीमेन दोनों सेक्सेस में। और न्यू कैंसर केसेस आए हैं 9,16,827। तो ये बहुत ज्यादा केसेस है, छोटे नहीं है ये केसेस हमारे। और एज स्टैंडर्डाइज्ड अगर मोर्टेलिटी रेट देखा जाए तो 66.5 और 62.6 ईयर में जाकर के जो हमारी डेथ है वो बढ़ रही है। तो आफ्टर द एज, वैसे ही एक एज के बाद आपका जीरियाट्रिक एज में आपके बहुत सारे फैक्टर्स हो जाते हैं डेथ के, और ये और एक रीजन बढ़ जाता है कैंसर की वजह से डेथ रेट अगर बढ़ जाता है तो थोड़ा सा दुखद है। तो हमें अपनी तरफ से काफी चीजों पर ध्यान देने की आवश्यकता है कि हम किस तरीके से इन सब चीजों पर बचाव करें। और जो 3 लीडिंग कैंसर के कॉजेज हैं, ब्रेस्ट कैंसर, या फिर आपका लिप कैंसर, सर्विक्स कैंसर, यूट्रस कैंसर और लंग कैंसर, इन पर हम बचाव कर किस तरह से हम ध्यान दें, इन पर हमें काम करना होगा।
Okay, next we move on to prevention. And prevention, abstaining from the use of tobacco products. Tobacco product like smoking, alcohol, smoking, and some other substance using like etc. And maintaining a healthy body weight. We already mentioned the obesity is one risk factor for cancer. And eating a healthy, balanced diet. Poor nutrition and nutrition deficiency is also risk factor for cancer. So, doing physical activity on a regular basis. Exercise is very needed for in every person, and avoiding or reducing consumption of alcohol, and getting vaccinated against HPV, human papilloma virus, and hepatitis B if belonging to a group for which vaccination is recommended. If some of them have any symptoms, so recommended person should be vaccinated. Avoiding ultraviolet radiation exposure, which primarily results from exposure to the sun and artificial tanning device, or using sun protection measures, and ensuring safe and appropriate use of radiation in healthcare. And for the therapeutic purpose, like X-rays, minimizing occupational exposure to ionizing radiations, and also reducing exposure to outdoor air pollution and indoor air pollution, including radon, um, and also participating in recommended cancer screening on a regular basis. These are the prevention methods. And here the graph shows the physical activity for the adult or young, everyone we can do. Like we include the physical activity on regular basis, which will help for the disease also, and we can maintain our healthy weight also. So every day we be an active in every person, like walk up the stairs even, or walk to the office, or walk to the shop, like small activities. And 5 to 6 times in a week we can do an at least minimum 30 minutes per day exercise, like brisk walking, aerobic exercise, and dancing, skipping, and cycling, etc. And 2 to 3 times in a week, we can participate in actively increase flexibility or strength and endurance of the muscle activities, like push-up and partial sit-up, leg press, etc., dumbbells, weightlifting, etc., and limit the physical inactivity and sedentary habit, like long hours on computer or online sites, and driving to a short distance. These are the physical activity we can include some little bit in every day. Next we move. early detection. Early detection. Okay. Early detection. Cancer mortality is reduced when cases are detected and treated early. There are two components of early detection: early diagnosis and screening. Early diagnosis consists of three components, like being aware of the symptoms of different forms of cancer and the importance of seeking medical advice when abnormal findings are observed. Like in everywhere we have heard about the sign and symptoms of like cancer, breast cancer, some lumps in breast or breast area. These are the early diagnosis, which belong to the early diagnosis. We know about the early symptoms of the cancer. Access to clinical evaluation and diagnostic service, and timely referral to treatment service. This include in early diagnosis. Next, we move on to screening. Screening aims to identify individual with findings suggestive of a specific cancer or pre-cancer before they have developed symptoms. If we like any, we already mentioned the sign and symptoms. If someone we feel like this much, then we should be taken any screening, like any lab test or some uh, X-rays like that. When abnormalities are identified during screening, further tests to be established to definitive diagnosis should follow, as should referral for treatment if cancer is proven to be present. Examples of screening methods are HPV tests, including HPV, DNA, and mRNA tests, and preferred for cervical cancer screening, and mammography screening for breast cancer, and also quality assurance is required for both screening and early diagnosis programs. Next, we move to type of cancer treatment. Nowadays, so many different type of treatment is available. There are many type of cancer treatment, and some people with cancer have only one treatment, but most of the people have a combination of treatment such as surgery and chemotherapy and radiation therapy. The type of treatment that receive will depend on the type of cancer and how advanced it, and sometimes cancer is spreading. Some of the early detection, we already mentioned early detection, so it's not spreading, so minimum one or two treatment is needed for them, but sometimes it's spread to other body parts, so it's need so many treatments. Like first one is biomarker test for cancer treatment. Biomarker test is a way to look for genes, proteins, and other substance like biomarkers or tumors that can provide information about cancer. Biomarker testing can help the doctors also choose which treatment should be given. And next we move to chemotherapy. Chemotherapy is a type of cancer treatment that use drugs to kill cancer cells. It's a hospitalized treatment. And next is hormone therapy. Hormone therapy is a treatment that slow or stop the growth of breast and prostate cancers that use hormone to grow. And hyperthermia. Hyperthermia is a type of treatment in which body tissue is heated to as high as 113 Fahrenheit to help manage damage and kill the cancerous cell with little or no harm to normal tissues. Next is immunotherapy. Immunotherapy is a innovative cancer treatment that boosts the body's immune system to fight cancer. Unlike traditional treatment, which target the cancer directly, immunotherapy works by stimulating the body's natural defense to recognize and destroy cancer cell more effectively. Next is photodynamic therapy. It uses drug activated by light to kill cancer and other abnormal cells. And radiation therapy is a type of cancer treatment that use high dose of radiation to kill cancer cells and shrink tumors also. And next is stem cell transplant. These are the procedure that restores stem cells that grow into blood cells. Sorry, in people who have had their destroyed by high dose of chemotherapy and radiation therapy. It is the restore the stem cell therapy. After chemo radiation, we do the stem cell transplant. And surgery. Surgery is the removal of any cancerous part. Sorry. And targeted therapy. Targeted therapy is a type of cancer treatment that target the change in the cancer cell that helping them to grow and divide and spread. These are the treatment nowadays available. And next we move to sorry. Next we move to what are the changes affecting body after treatment. Cancer related fatigue, we already mentioned the malnutrition, like chemotherapy induced some changes in body like nausea, vomiting, anorexia, etc. And also malabsorption of minerals and vitamins, and involuntary weight loss or weight gain, and also protein loss from the body, and also deficiency of vitamins like anemia, deficiency